You work out, you eat right, but no matter how healthy your lifestyle is, are you still at risk of being diagnosed with a rare disease? We'll ask the questions, we'll get the answers. I'm Erica Vitrini, and I'm delighted to welcome you to Access Health. Many of us take an active role in our well-being, but a healthy lifestyle isn't always foolproof protection against sickness. On today's Access Health, we're hoping to raise awareness on an illness you've probably never heard of, PNH, a rare blood disease. But first, let's meet our team of top-notch professionals who collectively help us cover all our health bases. First up, he's a distinguished breast cancer researcher and surgeon, our medical expert, Dr. Dennis Holmes. Next, she's our certified nutritional expert with tips on the best food to fuel our bodies, Janet Zapala. And the man who never met a push-up he didn't like, fitness guru Dave Sinclair. Welcome, team. Is it true?
It's true.
No, never won.
No, always.
Not even 101.
Love them 100% of the time.
And you can't tell.
No. Okay, so we talk about exercise, we talk about eating well, a lot on this show, because obviously that sets you on a path to a healthy lifestyle.
Yes.
But when it comes to PNH, all of the push-ups, all of the broccoli in the world, it's just not going to make a difference.
Yeah, obviously I'm a big proponent of working out, but this is clearly a case that calls for medical experts and not trainers.
Yeah, I have to agree. We all know that eating well is really important for everyone, but when it comes to this, I think it's really smart to hand it over to Dr. Holmes and to Erica to find out more about this medical rarity.
Definitely.
Mm-hmm.
Most doctors will never diagnose even a single patient with this diagnosis.
Wow, I didn't know that.
And many doctors haven't even heard of it.
So I guess, guys, that Dr. Holmes and I are on a mission of discovery, and whatever we find, we promise to bring right back here.
We'll be waiting.
Good. So stay with us to learn all about this rare disease called PNH, and if you are at risk. We'll be right back. Okay, we all know there are certain medical mysteries out there, but what is it like to be one of the few people in the world with an extremely rare disease? Or to be one of the few doctors in the world to have seen and treated it?
Well, in terms of unusual presentation of disease, I think for the doctor it can be pretty tough. I mean, one of the most difficult times I've had as a physician is treating a patient with an unusual presentation of a medical condition.
Absolutely. And we're about to find out exactly what it's like, because today on Access Health, we're dedicating the entire show to something called PNH. It's one of the rarest, most deadly blood diseases in existence. And we're going to start the discussion with Dr. Elizabeth Griffiths. She's one of the few doctors in the world who has actually diagnosed and treated PNH. Welcome, doctor.
Thank you for having me.
We feel really lucky to have you here on Access Health to bring awareness to PNH. Let's start with the basics, though. What exactly is PNH?
PNH stands for Paroxysmal Nocturnal Hemoglobinuria. And this is because patients in the past would present with abdominal pain, which were paroxysms, and they would complain of dark-colored urine in the morning especially, and people would identify that they had hemoglobin, or the breakdown product of red blood cells, in their urine. Many patients also present with debilitating fatigue and with unexplained blood clots, kidney dysfunction, and something called pulmonary hypertension, or high blood pressure in the lungs.
I first learned about this condition about 3 months ago, only about 3 months ago, and I assumed I'd never hear of it again. So I was a little bit surprised to find out that we'll be talking about it on Access Health.
It is a rare disease.
But I did learn a couple of things. Let me see if I remember them correctly. One is that this leads to toxic levels of hemoglobin and iron in the bloodstream. And it also leads to blood clots in just about any organ in the body. Is that so? And what should we look for if that happens?
The disease results from a problem with the bone marrow. The bone marrow problem is a result of a mutation that happens in the cell, in one of the cells in the bone marrow. And that mutation results in a loss of proteins on the cell surface of many of your adult cells in the circulation. Red blood cells that carry oxygen, white cells that fight infection, and platelets. Actually, many patients develop spontaneous mutations. And those spontaneous mutations don't confer a survival advantage in normal people.
Okay.
But if you have an immune attack on the bone marrow that can happen in some patients, a T cell attack on the bone marrow, those cells that are missing cell surface proteins can survive because they are not recognized by the immune system. As they survive, they become dominant, and their progeny, their children, are the responsible for making the red cells, the white cells, and the platelets. The survival advantage that they have in the bone marrow, though, is actually distinct because in the peripheral blood, in the circulation, those cells are missing essential proteins on the surface that protect them from attack by another part of your immune system called the complement cascade. And so these patients, their red cells and their other cells as well, are vulnerable to attack by the complement system. And so the result is that the red cells predominantly, but other cells as well, are broken inside of your blood vessel directly, which releases hemoglobin, which is normally stored inside of those red cells. The hemoglobin is directly toxic to your kidney.
And it should never be.
It should never be free.
Yes.
That's correct. So the hemoglobin is directly toxic to your kidney and can cause kidney dysfunction. And the surface part of the red cell, the membranes of the red cell, are actually directly activating to the clotting system of your body. And so these patients can get devastating blood clots.
So, I mean, is that the only sign or symptom that a doctor and patient should look for, or are there others that they should look for?
So many of these patients, as I said before, have debilitating fatigue that causes them to be disabled. And when I say fatigue, I mean these patients, they are sleeping 12 hours a day and they're still exhausted.
Oh, really?
Okay? And they can't hold down a regular job because they're so tired. So I would say in the combination of very significant exhaustion with an unexplained blood clot. So mostly patients who have blood clots have a provoking symptom. They had a surgery, they were on a long car trip, they took a long flight. These patients would present with no presenting symptom. And there are a variety of genetic conditions that can predispose you to that, but PNH can also do that. And I guess the other thing that would make me very thoughtful is if you saw those things together with a low blood count. So most patients with PNH will have a low red blood cell or low hemoglobin or a low platelet count or a low white cell count.
And you also talk about tummy aches.
So many patients will also have abdominal pain and spasm in their esophagus. And these result from the free hemoglobin. Free hemoglobin scavenges something called nitric oxide, which is important for relaxing those muscles.
So what are the challenges that you face in diagnosing this extremely rare disease?
So because the symptoms can sound quite common, it's really important to think about the accumulation of all these symptoms together. So the presence of an unexplained blood clot in association with very severe fatigue and a low blood count. For me, those things together would make me very suspicious. Also, unexplained kidney failure. Patients who have an unexplained kidney failure or shortness of breath out of proportion to the degree of anemia or the low blood counts.
You know, we talk about this being a rare condition, but how rare is it?
Yeah, so there are about 15 to 16 cases per million of population, which makes it actually an ultra-rare disease.
So now that I know about it, is there a test I could use to diagnose it?
Yes, so there's actually a blood test, and it's important that it be done on the peripheral blood because, as we talked about, the stem cells in the bone marrow can have a variable proportion.
So the peripheral blood is the
cells in your blood are the ones you get when you get a blood test from your arm. So the ones inside your blood vessels, versus the ones where they're being grown. So you can think of the bone marrow as like your garden where you're growing the cells, and the peripheral blood is like the grocery store where the cells are doing their job.
Got it. Go to the grocery store.
So you want to go to the grocery store for this, and you do this test on the blood that you draw from your arm. And you look for the absence of those protein protectors that I was talking about before. And you want to make sure that it's done on a couple of different cell types, so both the red cells as well as one of the white cells, because the red cells can be falsely low.
But you can go to your doctor and say, there's a test, can I take this test?
You can, that's correct.
Yeah. And how deadly is this disease?
Once they've been diagnosed after 5 years, 35% of patients were dead from the disorder, and usually as a result of blood clots or kidney dysfunction.
How can we better manage that, or can we, in order for that not to be the situation?
Yeah, so based on the understanding of the cause of the disorder, so based on understanding that the mutational event at the bone marrow level was the cause, there have been developed therapies that can address this disorder and can improve outcome for patients.
So that's relief. I mean, the fact that we now have a greater understanding of it, that there's a test to diagnose it and some management options to deal with it must be a godsend to people who haven't had these solutions in the past.
Indeed.
Absolutely.
But I think a lot of credit also goes to physicians like you who've committed time to understanding this condition and to offering solutions to patients who are facing it.
Yeah, we feel really lucky to have you here, Doctor. Thank you so much. And I know that we'll be joined with 2 patients who are actually living with PNH. I look forward to hearing their stories and, again, bringing more awareness to PNH. And in the meantime, if anyone out there has any of the symptoms we just described, be sure to talk to your doctor and log on to accesshealth.tv for more information about PNH. Well, we're now joined here in the Access Health studio by 2 very special guests, Sharon Telsford and Brianne Sanborn.
Sharon and Brianne are 2 of just only a few thousand people in the entire world who've been diagnosed with a rare blood disease called PNH. I'm happy to have you both on the show. It's really a pleasure to have you and a privilege really to have you here because it looks like you're living and thriving in spite of the diagnosis.
So let's talk about what life was like before you were diagnosed with PNH, and when did you first start to see the symptoms, Brianne?
Before PNH diagnosis, I was active. I work at a golf course and play lots of golf during the summer. I also attended a college in Michigan where I was learning to be a secondary education teacher. Other than that, no major health problems. In June of 2008, I had severe piercing pain right in my sternum, and my blood counts were actually low. So I started seeing a hematologist, and it come to find out my gallbladder needed to be removed. So had the normal surgery, just this, with my counts being so low, I needed to have a blood transfusion and some platelet levels rise before I had the surgery. So felt fine afterwards, and then June of 2009, I started to have the same symptoms in my stomach and lower back pain, along with really dark urine. So I started seeing the hematologist more often and had a few more tests being run. I had a bone marrow test done, and I also felt really fatigued and kind of out of it. So it just wasn't fun.
Sharon, I'm interested in knowing what your life was before the diagnosis. And what symptoms did you have?
Well, my life before diagnosis, I was very active, ran in marathons, I did a lot of swimming, I was taking dancing, but throughout the years, I was always told by doctors that I was borderline anemic. But then in 2006, found out that I had thyroid disease, autoimmune disease, and that next year in 2007, I started getting low blood counts. So my primary care doctor decided to send me to a hematologist. He ran some tests as well. The blood counts were still very low and decided to do a bone marrow test as well. He came back and said I had MDS. What he wanted, he sent me to a cancer center to have another opinion. They said I had MDS. At that time, I decided I would go get a third opinion from an MDS specialist at another cancer center. So that's what I did.
And Brianne, when did you finally get your diagnosis of PNH, and how did you feel?
In July 2009, I spent a week in the hospital, and during that week, I had a really swollen abdomen and face, and my dad noticed this, and the stomach pain I was feeling that summer was a blood clot in my liver. So with this news coming in and the research all going to figure out what all my test results were, it came back that I had PNH. So when I got the news, I was like, okay, well, I don't really know what this is. I'm 23, but what does this all mean? It didn't seem that bad. But I looked over at my parents' faces and they were just kind of mortified. And so I realized right then that it is probably something very serious, and to figure out, you know, what it actually means to have PNH.
Sharon, I'm interested in knowing why you went from the first opinion to a second opinion, which was in agreement with the first, to yet a third opinion before you arrived at your diagnosis. What led you to that third opinion?
I decided I would take things into my own hand because this is my life you're talking about, and I wanted to go see a specialist in MDS. But when I got up there and I told him all my symptoms, he said, well, I'm going to run some tests and I'll get back with you. He called me back about a week later and said, I have good news and I have bad news. The good news is you don't have MDS. The bad news is you have PNH. My family and everybody, I informed them what happened, what my diagnosis was, because it was a rare blood disease.
Brianne, what's the next step as far as you find out you have PNH? Where do you go from there as far as support?
Well, my support comes from my family. I'm an only child, so my parents are the support. I have a wonderful group of friends that went and looked up what PNH was, and they were very interested in to figure out what the symptoms and signs were, and just keeping the knowledge of what it is that I have and what PNH actually means. My doctors are awesome. My physician's assistant is just wonderful, and we have a really great bond. And I was also fortunate enough to meet a specialist in Baltimore to figure out a little bit more about the disease, because it is so rare to actually talk to someone who knows everything about PNH.
And for you, Sharon, where did you find your support?
Well, with my family, yes, but there were also conferences. My first conference that I attended, I came there with about 10 family members and friends.
Your entourage.
They couldn't believe, like, where are these people going? My family and friends have really been there. I have great doctors now.
Well, as a breast cancer specialist and a patient advocate, I can certainly vouch for the importance of having a strong support structure around you, especially when you've been diagnosed with a condition that can potentially be life-threatening, because the support can make all the difference in the world.
Yeah, and we're just so happy to have you here to spread awareness, to tell us your stories, but you're not going anywhere. When we come back, Dr. Griffiths is going to rejoin us here to talk more about PNH resources and the community of support and patient advocacy that you've both become part of. And in the meantime, of course, you can log on to accesshealth.tv for all kinds of PNH resources and information. I'd like to welcome back PNH specialist Dr. Elizabeth Griffith, along with PNH patient advocates Sharon Telsforth and Brianne Sanborn. Doctor, let me start with you. PNH is a very rare disease, but it seems as though it's becoming increasingly easier to diagnose from a physician standpoint. Do you think that's true?
I think there's enhanced awareness of the disorder and the symptoms that go along with the disorder. And I think the combination of a very accurate test in the peripheral blood with recognition of the symptoms and signs of the disease have really made a significant improvement in terms of helping people get diagnosed expeditiously.
And it is just a simple blood test.
That's correct.
Yeah. How rare is it, really?
Again, 15 to 16 cases per million of population, so exceedingly rare.
Brianne and Sharon, you've been living with PNH now for several years, and you have it under control, and we're so grateful for that. Tell me a little bit about the support you've received along the way, Sharon.
My family and friends are very supportive of me. I've been going to the PNH conferences. We all get together in groups, everybody tells their story, and you can always learn something from other people. There's also the NORD organization, which is a national organization for rare diseases. And I've discovered that there's a PNH app now that I've loaded onto my phone.
Look at you.
Yes, and there's a website, PNHsource.com, that we can also go to get information regarding the disease.
My support has come from friends and family as well, and I have guided them to certain websites and just information that I can give them about signs and symptoms.
So, Doctor, I know you are also very involved. Tell me about what you've done as far as awareness and education when it comes to PNH disease.
So I've been really lucky in my career. Where I trained, I received a lot of exposure to PNH and to the diagnosis and to the pathophysiology of the disease. Based on my experience, I've had the opportunity to teach residents and fellows, both locally and nationally, as well as other doctors.
And I know, Brianne, you've actually just finished 2 speaking engagements.
This summer in July, through NORD, I was able to speak on a teleconference, and it was where I got to share my story. And then it was a nurse who followed up with information about PNH and was able to tell everybody, you know, what it actually means to have PNH if you were just listening, because it was someone who was a patient could be listening or a caregiver.
And Sharon, I know you've also been speaking.
There was a PNH luncheon that was given in Baltimore. I was the patient advocate for that engagement, and it was really amazing having to share my story and listen to other people's story as well.
I think you two, all of you, are just amazing, and I really can't tell you how thankful I am to have you here on the show raising awareness, and we're so glad that you are doing so well, Brianne and Sharon. And Doctor, thank you for all this great information. It's good to have you here. Now, if you have any of the symptoms we described, speak to your doctor and ask him for the PNH blood test. And for more resources and information on PNH, head straight to accesshealth.tv. I'm so glad we had the opportunity to have Dr. Griffiths on the show today. She was very enlightening.
Oh, yeah.
most people don't know about this condition, so it's really important for us to get the information out there about it.
Exactly, and our thanks to Sharon and Brianne for sharing their personal stories with us. Now we are a little more informed and enlightened about this condition.
Yeah, and it's great to see that they're doing better now.
No, I couldn't agree more. All clear on Access Health. And on behalf of Dr. Dennis Holmes, Janet Zapala, Dave Sinclair, and myself, we'll see you next time on Access Health. And for more information, you can go straight to our website at accesshealth.tv, or you can visit our Facebook page.